I'm a former Major League Baseball physical therapist that helps injured pitchers get back on the mound. And I want to go over today several banded shoulder mobility drills I will use for pitchers that have some type of shoulder mobility restriction. So specifically going into maybe internal rotation or overhead, or those that have some anterior front of the shoulder pain, whether it's with lifting or throwing. So the reason that we want to look at shoulder mobility without going into too much detail is from a throwing standpoint, you want to make sure as a pitcher you have sufficient external and internal rotation individually, but also together. So when we look at together, it's called our total range of motion. And you want that to be your total internal and external on your throwing side. You want that to be within 5 degrees of your total range of motion on your non-throwing side. Now, when we look at the individuals of that, so internal individually and external individually, specifically internally, we don't want to see, it's very common for pitchers to be lacking internal on their throwing arm. I mean, in every case for pitchers, that's how it's going to be. But you don't want to have a deficit of 20 degrees or more difference in internal rotation shoulder range of motion on your right side compared to your left side. And there's a lot of different reasons as to why this could happen. There's sometimes a mobility restriction in the back of the shoulder, the posterior cuff, and the posterior capsule, or it could be a stability issue that they just don't have the stability to control that rotation from the shoulder there. But for today's purposes, I want to go over these shoulder mobility restrictions, specifically in that posterior capsule, posterior tissue, rotator cuff, lat. So a lot of this is going to be targeting that. So all you're going to need is a heavier mobility band. And ideally, you have somewhere to attach it up high. So I have it attached to a pull-up bar here. That seems to work well for a lot of people. So what you're going to do, the first one is going to be much more of a lat and a lateral line stretch. So you're going to grab the band here. You're going to have your thumb facing up. So let's say I'm stretching my right hand here. My left leg is going to be forward. My right leg is going to be behind me. And I'm essentially sitting back and away. So you should be getting some overhead movement, but also a lot of expansion throughout that lateral side here. So you're going to get that stretch up in the armpit, but you should also get it right along the side here, along that rib cage. Now, what you want to make sure you're not getting any pinching on the front of the shoulder. If you are getting that, we want to change some things up. I don't want pinching because that means you're getting a little more contact on a structure that doesn't necessarily want to have that extra contact on it. So that's your first one, that banded lat and lateral line stretch. You can do this from a warm-up standpoint, 2 sets of 30 to 45, maybe even upways of 60 seconds if you're really tight. It could also be more of a restorative on your non-throwing days, your lighter days, to help just regain range of motion, especially like after a day you pitch. The next one is going to be a banded lat and Teres major stretch. So for this one, what it's going to look like, you're going to get a lot more armpit on this one versus the kind of side of the side of the trunk. It's going to be a lot more armpit. So what you're going to do, elbow is going to be in the band here. You're going to be holding on to the band here like so. Some guys can kind of have a free-floating hand. I just kind of like a light little kind of just almost you're just placing your hand there. You're not death gripping. You're just placing your hand. Other leg's going to be in front. And then what you're going to do, you're going to essentially just let that band bring your elbow up towards the ceiling. And you're going to stop once you feel that stretch in the armpit. And we're just hanging out here. Nothing crazy, just kind of nice and easy. Breathing in, breathing out. Again, this is going to be a lot more armpit. You're going to feel that scap rotating up. You're not going to get a lot on the side of your trunk here, which is totally fine. We don't want that on the side trunk. We want this to be much more in that armpit. Okay, so same thing, 2 sets, 30 to 45 seconds, maybe upwards of 60 seconds if you're really tight. The last one we're going to do is much more of a posterior capsule specific stretch. So a lot of times people will do the sleeper stretch. They're on their side, pushing down here. I'm not a fan of the sleeper stretch. I find more often than not it's very hard for guys to isolate that stretch in the back of the shoulder. And more often than not, they get that shoulder pushed forward, and now they're just kind of getting jammed into that subacromial space or that bicep tendon. So this is a good alternative for it. So what you're going to do, keep the band in that same position there. You're going to be having your arm across body. You're going to be holding the band here. And you're just nice and easy, just kind of leaning away from the band. So you should feel this right in that back of that shoulder here. What I don't want is I don't want your shoulder blade being pulled around, and you're certainly not rotated with it. You're just in this position here, nice and easy, leaning away. Breath in, breath out, getting a little bit more range of motion each time. That one's typically tight on a lot of guys, and they'll feel a very strong sensation there. So you want to make sure you're very slowly easing into that for that same kind of set and rep scheme that we talked about for the other 2 stretches. So those are 3 banded shoulder stretches and mobilizations you can do from certainly either a warm-up or a cool down, or even a day after your high-intensity day, a day after a bullpen, a day after a game. And we know guys are typically going to lose range of motion that next day. And if we want to help restore to help minimize that mobility restriction, these are some good alternatives and some options to use in your mobility routine. So if you have any questions on these movements, you're dealing with shoulder pain, drop your questions below in the comment section and subscribe to our channel for more weekly baseball performance and rehab content.